Chapter 10, it's about the muscular system. Our muscles constitute nearly half of our body weight, and they are used in several fields of healthcare and fitness. For instance, nurses in pediatrics, they use this vastus lateralis muscle, which is this that you can see here in the leg, to apply intramuscular injections in children. In exploratory surgeries, surgeons, they open the abdominal cavity here at the linea alba of this muscle that is called the rectus abdominis, which we also know as six-pack, so that they can see what is going on inside the abdominal cavity of the patient. So the skeletal muscle fibers, if we recall from the muscular tissue chapter, they have a vast number of mitochondria and blood supply because they are constantly contracting and they demand large quantities of ATP. And most of our muscles, they have both slow and fast fibers, and the slow fibers can be found in muscles that maintains posture, like the calf and the back muscles. And the fast fibers will be located in areas where we perform fast movements, like the muscles in our eyes. And several of our muscles are under the influence of hormones like thyroid hormone. And someone who has, for instance, excess of this hormone will generate more heat and energy. So muscles, they have several functions, including production of movement, maintaining posture and stability, guarding entries of our body and exits of our body, and also to generate heat and to control the levels of glucose in our body. So movement, it's the property of using our muscles to move from place to place or to move body parts. And in these body parts can include hollow organs, like the ones that we have in our digestive tract, so we can perform digestion. Also, we have muscles around the blood vessels, so we can move our blood, or we can have muscles in the respiratory system that allow us to breathe. Also, muscles are used for communication, like we have the laryngeal muscles, or we have the muscles of the tongue that help us to produce speech. Also, we have muscles that allow us to write, and we have the muscles in our face that allow us to express our emotions or to have nonverbal communication. Many of our muscles as well are important for maintaining stability, like the ones that we have in our back, and they help us to maintain stability because they prevent us from producing unwanted movements. And we have also specific muscles that are called anti-gravity muscles that prevent us from falling over. And then we have these muscles that stabilize the joints by helping us to maintain a specific tension. And then they control several tendons and bones. Also, our muscles that controls the openings or passageways in our body have a very important function because they encircle several areas of our body that they need to be maintained closed at a specific time, and then they need to be open. Such muscles, they form a circular layer that we know as sphincters, and these sphincters help to move substances or food from one area of the body into another. Now, the skeletal muscles, they produce 20 to 30% of the body heat, and the rest are producing up to 85% of the body heat when we are exercising. And again, the heat that it is produced by the muscles is dissipated by the integumentary system, which is one of the key points. Now, glycemic control is the means of the regulation of the blood glucose concentration within its normal range. And several of our muscles play a role in this by absorbing, storing, and use large of the shares of one glucose, and they maintain a specific blood concentration of glucose. Now, in old age, in obesity, when the muscles become deconditioned and weakened, people can suffer an increased risk of having problems of glycemic control, so they can have type 2 diabetes because the muscles decline in their function of maintaining this glycemic control. So we have many muscles in our body. We have around 600 muscles, and as we said before, they constitute half of our body weight, and these muscles are a skeletal muscle that we have, these 600. Now remember as well that we saw in the previous chapter that we have two types of muscle. We have a skeletal muscle, cardiac muscle, and a smooth muscle. And they have different locations, so skeletal muscle is majorly attached to the skeleton. Cardiac muscle is only located within the heart, and the smooth muscle within hollow organs. And they have this innervation, so skeletal muscle is innervated by the somatic nervous system, while cardiac and smooth muscle are innervated by the autonomic nervous system. Now, the muscles are specialized for one major purpose, which is converting the chemical energy that is found in adenosine triphosphate, or ATP, into mechanical energy, which allow us to produce movement. And myology is the branch of science that studies the muscular system. So our muscles are organized into different structures. So we have this outer layer of muscle that surrounds these fascicles that is called epimysium. So from external to internal, this is the levels of organization of our muscles. So we have this layer that is called the epimysium that surrounds the entire muscle and its fascicles. And then we have this perimysium, which is the layer that surrounds these fascicles that you can see here. So this is one single fascicle surrounded by its perimysium. And then here we will have the endomysium that surrounds these muscle fibers. And then inside the muscle fibers we have myofibrils. So this is one of the previous key points that we just saw before. So these are the connective tissue layers of a muscle. Then we have this perimysium, we have this endomysium, and then we have these muscle fibers in here. And all of these that are running in longitudinal section, these will be the muscle fibers, and this will be a longitudinal section of a fascicle. And this will be the transverse cut of this fascicle and these muscle fibers. So we can classify the muscles, the skeletal muscles, according to the orientation of the fascicles. So the fascicles can be oriented in a variety of ways, and that will help to determine the strength of the muscle and the direction of the pull of the muscle. So muscles that have a thick part in the middle with a taper end, like in this case this biceps brachii muscle, are considered fusiform muscles. So the biceps is one example of these fusiform muscles in the arm, but we have a gastrocnemius muscle in the calf that it is a fusiform muscle because they have a thick center and they have taper ends. Now parallel muscles, they have fairly uniform width of parallel fascicles, and they don't have a thick middle part and a taper end, so they have a uniform thickness in general. So they are some elongated strap muscles like the ones that we have in the abdominal area, like the rectus abdominis, which is also known for us as the six-pack muscles. But we have other muscles like the sartorius in the thigh or the zygomaticus in the face, and these will be, like I said before, uniform in their orientation. Now, triangular muscles or convergent muscles are fan-shaped. They have a broad end, like this, in this case, this part, and then they have this ending that it is narrow. So these are muscles that are having this feather shape or shaft. And we have the example of this pectoralis major, which is located in the anterior area of our thoracic area, the chest. And then we have other muscles, like in the case of the unipennate muscles, in which you have all the fascicles approaching one tendon, like in the case of the palmar interosseous muscles that we have in our hand and the semimembranous muscle in our thigh. Now we have other muscles that are called bipennate because you have these muscles oriented towards this common tendon in the center. So you have a center that it's located here, as you can see, and then you have these angulated fascicles going towards the center. In this case, this will be the rectus femoris of the thigh, and the fascicles, as I said, approach the tendon from both sides. Now, sometimes some muscles, they're shaped like a bunch of feathers with their quills converging into a single point, which is this, and these will be called multipennate. This multipennate muscle, one example that we have will be the deltoid muscle that we have in the shoulder. Now, other muscles are sphincters, like in the case of the orbicularis oculi, that forms rings around certain body openings, and when they contract, they constrict the opening, and then they tend to prevent the passage of material through it. So the orbicularis oculi, we have it in the eyelids, or we have, for instance, the external urethral and anal sphincters. Now, the smooth muscle fibers in our body also form sphincters. So, for instance, we have one sphincter is called pyloric valve, that it is preventing the stomach from emptying into the small intestine when it's not necessary. Other sphincters made out of smooth muscle are located within the urinary tract or the anal canal. So the muscle strength and the direction of its pull are determined partly by the orientation of the fascicles. So I already explained to you how this classification it is given according to the orientation of the muscle fibers. Now, several muscles are located functionally within an area, and this area will be called the muscle compartment. And this area, it is confined or enclosed by a fascia. So the fascia are not compartments of the muscles themselves, but package them into groups with functionally related muscles into these muscle compartments. And several of these compartments not only have muscles, but also they have nerves and blood vessels that supply this muscle group. And some of these muscles are separated from each other in this muscle compartment by septa, which are thick fascia that separates one compartment from another and one muscle from the other. For instance, the thigh binding of muscles by the tension, this fascia contributes to this compartmentalization of the muscles. So here is one example of a muscle compartment that is located within the left leg. So this is the cross section of the left leg, slightly above the mid calf, and it's oriented in the same way as you are looking at it. Okay, so if this part that you're seeing here on the top, you see this arrow, this will be the anterior part, this is what you will be looking at, and then this will be posterior, this is medial, and this is lateral. So we have this fascia in here that it is called the intermuscular septa. This will separate this posterior compartment, the superficial layer, from the lateral compartment, which is this one in blue. So all of these muscles in here will be the posterior compartment superficial layer, and this will be the lateral compartment, the ones in blue. And then in here we'll have the anterior compartment that it is located in between these two bones, which is the fibula and the tibia, and this is the interosseous membrane, if you remember from the compartment or the chapter for the bones. And then this one that you see here in orange will be the posterior layer, posterior deep layer. And then here in this posterior deep layer you have some artery, veins, and nerves, as you can see here, and so in here in the anterior compartment. So usually these muscles, they have a different function when they are located in compartments. Now the muscles, they have different attachments into the skeletal muscle, so they have direct and indirect attachments. So muscles with direct compartment will be what we call the fleshy attachment, such as the brachialis and lateral head of the triceps. There is little separation between the muscle and the bone that to the naked eye it seems like they emerge directly from the bone. So that's why it's called the fleshy attachment. Now in the indirect attachment, the muscle ends visibly short of its bone's destination, and you will have a gap that is bridged by the fibrous cord of a band of connective tissue, the dense connective tissue that we know as tendons. And some of these muscles, they have a broader tendon that is known as aponeurosis or flat sheet, like the palmar aponeurosis, or they can have a band of connective tissue that it is called retinaculum. So this retinaculum separate muscles that pass under. So the muscles attachment, they can be classified as origin or stationary or insertion and moving. Now usually the origin is located proximally while the insertion is located distally in the muscles of our limb, but sometimes you have some exceptions. In some anatomies, they prefer the non-traditional descriptions of attachments by proximal versus distal or superior versus inferior. Now, some muscles attach not on the bone but on the fascia or tendon of another muscle or the collagen fibers of the dermis, like, as we said before, the muscles in our face that are attached into the dermis of the face, with few examples. With few exceptions. Now, there's another classification of the muscles that is called intrinsic for the muscles that are located within a specific region, like the intrinsic muscles of our hand, and some others are classified as extrinsic because they act over a specific area, but they are located outside of that area. For instance, we have inner fingers extrinsic muscles in the forearm. I mean, remember, our muscles that are located in the forearm are located in the forearm, but they can act over the muscles of our finger, over our fingers, which are located within our hand. Now, according to action, the muscles can be classified as prime movers for the muscle that produces most of the force during a particular joint action. For instance, in flexing of the elbow, the prime mover will be called the brachialis. Or in the flexion of the forearm against the arm, this will be the biceps brachii. That will be the prime mover or agonist. Now we have synergies, which are muscles that aid the prime mover. And two or more synergies act on a joint, and they can produce more power than just a single large muscle. So many of them, as well, the synergies can modify the direction of the movement or stabilize the joint that is nearby. And a synergist, when it's restricting this movement, it will have to do it in a coordinated, specific manner. Antagonists will be the muscles that oppose the prime mover, and in some cases they relax to give the prime mover almost complete control over an action. So we have antagonistic pairs, like as I told you, the biceps brachii, which helps to flex our forearm against our arm, will be the prime mover of this movement. But the triceps brachii, which is located just posteriorly in our arm, will antagonize this movement. And we need antagonist pairs at the joint because muscles can only pull, not push. And which member of a pair acts as a prime mover depends on the motion. So sometimes if you want to extend your elbow, you use your triceps, for instance, but in the case of the what we call the prime mover of flexion of the forearm, now in this case this muscle needs to relax, so their roles will be reversed. And then fixators will prevent the bone from moving. So to fix a bone means to hold it steady, allowing another muscle attached in this bone to pull it on something else. For instance, consider again the flexion of the elbow by the biceps, or the forearm by the biceps. The biceps originates in this bone, the scapula, and then it crosses both the shoulder and the elbow joints and inserts at the radial tuberosity in the radius and the forearm fascia. So the scapula in this case is loosely attached to the axial skeleton, so when the biceps contracts, it seems like it will pull the scapula laterally. However, we have fixator muscles like the rhomboids that attaches in the scapula and the vertebral column, preventing this lateral pull of the scapula. And they contract at the same time as the biceps, holding the scapula firmly in place, ensuring that the force that is generated by the biceps moves only the radius rather than the scapula. So that's how the fixator works. So this is synergistic and antagonistic muscle pairs. So here we have these synergistic muscles for flexion of the forearm or the elbow, which will be the biceps brachii and the brachialis. So these will be the flexors. And then in here we have this muscle, the triceps brachii, which is having this long head and the lateral head shown in here, that acts as the antagonist of this flexion. So while this one flexes the elbow, this one will extend the elbow. But sometimes if you want to extend the elbow, this will be the agonist, while this will be the antagonist. Now our muscles are innervated by several nerves, and these nerves are branches of the somatic nervous system. Now the somatic nervous system reaches these muscles through the spinal nerves that are located or emerging from the spinal cord, and they emerge through the intervertebral foramina. And the spinal nerves, as the similar to the numbering of the vertebrae, are identified by letters and numbers. So for instance, T6, which is the sixth thoracic nerve, this will innervate specific muscles like the sixth intercostal muscle. S2 will be for second sacral nerve. And some of these spinal nerves will merge together and they will form collection of fibers that are going to form like a web that is going to be called a plexus, like the sacral plexus or the lumbar plexus. So these spinal nerves then arise from the spinal cord. Now we also have the cranial nerves that innervate several muscles, but these, since will be muscles, nerves that are located that next to the skull, and they emerge through the skull foramina, they will innervate muscles of the head and the neck. And the cranial nerves are identified by Roman numerals 1 through 12, and the abbreviation for cranial nerve will be CN. And at some point, we will talk about these spinal nerves, their plexuses, and the cranial nerves, and their numbers and their function in the following chapters. Now, this is just an image to show you how these nerves of the somatic nervous system forms tiny fibers which are part of the motor neuron unit, and they connect to these individual muscle fibers, forming a neuromuscular junction. So this will be the skeletal muscle fiber, you can see it here in blue, and then this will be the axons of the motor nerves, the nerves that allow us to move our muscles. The skeletal muscles are known as motor nerves, and then this area specifically will be called the motor end plate, the area of the muscle that it is in contact with this nerve. The muscular system has a very heavy demand for energy obtained from ATP, as we said before, and thus it receives a generous flow of blood. And this flow of blood is about 1.24 liters per minute at rest, and it represents 1/4 of the blood supply given by the heart. Now, when we exercise heavily, our cardiac output, or the amount of blood supply that the heart provides to the body, increases, and the muscular system will share its more than 3/4 or 11.6 liters per minute. So we have these capillaries of skeletal muscle that undulate or coil when the muscle is contracted. So you will allow enough blood supply to reach into these muscles. And these capillaries, they run through the endomysium to reach every muscle fiber. Learning the names of the muscles, it's important because you need to know where they are located, and sometimes this naming help us to know what is the action of the muscles. And the muscles, most of them, they are paired, so this huge number that we saw before of how many muscles that we have in the body can at some point be divided in half, and many of these muscles, they have these names that are the same in different regions, like the ones that we have in our hand, and they are easy to learn. Now, when someone has this difficulty in naming the muscles, it helps to learn a little bit of Latin, because many of these muscles, they are derived from Latin roots. For instance, depressor labii inferioris means depressor means depressing or bringing down, labii means lip, and in inferioris or inferior means going down. So we have a muscle just in our lower lip that depresses our lower lip. And then flexor digiti minimi brevis. So this flexor means that you are flexing, and then minimi stands for the smallest, brevis will be short, and then digit for finger. So muscle names are interpreted in footnotes throughout the chapter, but flexor digiti minimi brevis means that this is the flexor of the smallest finger, and this is the short, because we have a longus. So the muscle's naming describes distinctive aspect of the structure, location, or action of a muscle. And then if you want to learn a little bit of the pronunciation, there is this site that you can go and look at it, so it can help you a little bit. So this is the muscular system, the anterior view, and this is the posterior view. We're going to see right now the overview of all the names of the muscles, but we will see the individual muscles by region. So this muscle that you see here, that is over the frontal bone, is called frontalis. So that's how I told you that sometimes it's not hard, just because in this case, some of these muscles are located or named according to the bone that they have nearby. So this is the frontalis. This muscle that you see here is the auricularis oculi for eyes. This will be the zygomaticus major. This will be the masseter. And then this will be sternocleidomastoid, platysma in here. This is the deltoid. This is the biceps brachii. This is pectoralis major. This is superficial. And then this will be the serratus anterior in here. This will be the external abdominal oblique. This will be the brachioradialis, flexor carpi radialis, and then in here we'll have the flexor carpi ulnaris. And then in here will be the deep muscle. So this will be the pectoralis minor. So if you remove this pectoralis major and all these layers, you can see it here deep. And then this will be the rectus abdominis. This will be the transverse abdominis muscle. This will be the internal oblique. This will be the external oblique. And then in here you have the brachialis. This muscle in here will be the flexor pollicis longus. And this one in here will be the flexor digitorum profundus. And then in here the superficial muscles of our legs. This will be the tensor fasciae latae. This will be the sartorius. This muscle as a whole is called the quadriceps, but we only can see 3 parts of the quadriceps. This is the rectus femoris, vastus lateralis, vastus medialis. This is the adductor longus. And then in here we have tibialis anterior, fibularis longus, and then extensor digitorum longus. Now, if you remove part of these muscles, you will be able to see the adductors, which are all of these here. This will be the vastus lateralis again. Vastus intermedius, this is the 4th head of the quadriceps, so the one that's underneath this rectus femoris. This will be the gracilis. This will be the gastrocnemius. This will be the soleus in here. And then in here again, we have the extensor digitorum longus. So in the posterior view, the superficial muscles first and then the deep muscles. So this is the occipitalis. Again, its name is taken by the location next to the occipital bone. And then in here we have the trapezius, which is this broad muscle, triangular muscle. And this muscle will be the infraspinatus, teres minor, teres major. And then this broad muscle, this will be the latissimus dorsi. And then in here we have the triceps brachii. This is the shoulder muscle. This is the deltoid. And then this is the external oblique, the posterior view. And then this muscle in here will be the extensor carpi, radialis, longus, and brevis. So this is the longus, this is the brevis. And then in here we have the extensor digitorum. And then this will be the extensor carpi ulnaris. Here in the gluteal area we have the gluteus medius. And then in here this will be the gluteus maximus. Now, before we move on with the name of the rest of the muscles, so the gluteus medius, deltoid, and vastus lateralis, these are sites of intramuscular injection. But remember, in children, vastus lateralis is the preferred site for intramuscular injection. Now, here we have these muscles that are called the hamstrings. So we have the biceps in here, biceps femoris. We have the iliotibial tract of this muscle, which is called the tensor fasciae latae. And then in here, we have the semitendinosus muscle. And then in here, this is the semimembranosus. And then this muscle, this is the gracilis that you can see here and in here as well. This is the gastrocnemius or calf muscle, and this is the soleus. And then if you remove this layer, you can see the deep muscle. So this is called the semispinalis capitis. This is the sternocleidomastoid. And then this is the splenius capitis in here. This is the semispinalis capitis in here. This is the splenius capitis. And this is the levator scapulae. This is the rhomboid minor. This is the rhomboid major. This will be the supraspinatus. This is the infraspinatus. Remember, this is the spine of the scapula. And then in here, we have the serratus anterior. All of these muscles in here, these are the serratus posterior inferior. These are the external abdominal oblique. This is the internal abdominal oblique. This is the triceps brachii. In here, this is the deltoid cut. This is part of the brachioradialis. It's not labeled. This is the flexor carpi ulnaris. In here, this is the extensor digitorum. And then in here, we have the iliotibial tract of the tensor fasciae latae. This will be the semimembranosus, and this will be the biceps femoris. So semimembranosus in here medially and biceps femoris in here. And then if you move the gastrocnemius, if you cut it, you will be able to see the flexor digitorum longus in here, flexor hallucis longus in here, and then fibularis longus. And this muscle, the tibialis posterior. So one thing that it will help you to learn the muscles is just whenever you have a chance to examine models, if you go to medical school, perhaps you will have the chance of seeing a cadaver, or if you go into other schools, they will show you dissected animals. Most of us have access to photographic atlases, and as you read these muscles, try to visualize the images, and also try to be descriptive in some of the things that you can learn. Also palpate your muscles if possible. Contract the muscle to feel its bulge and sense its action. For instance, right now you can feel the action of your biceps just by flexing the forearm and feel anteriorly in your arm how does it feel. Locate the attachment of the muscles on articulated skeleton. And some skeletons have their attachment painted or labeled, and this will help you to visualize the muscles and understand how they can produce particular actions over the joints Also say the names aloud to yourself or study partner, and if it's harder to remember, spell the terms that you cannot pronounce. And silent pronunciation is not nearly as effective as speaking and hearing the names. And as we mentioned in the previous slide, there is this site where you can visit for looking at the pronunciation of the names. Now here then, this is a better view of the muscles of facial expression. So these muscles of facial expression, again, they're attached into the dermis, most of them, with few exceptions, in the face. And the muscles of facial expression, with one exception, which is the levator palpebrae superioris, which is not labeled in here, but it will be one muscle that is located in here. They are innervated by cranial nerve number 7, which is called facial nerve. And if someone has paralysis of this facial nerve, it might not be able to move these muscles of facial expression. But all of them are innervated by cranial nerve number 7. Now, the levator palpebrae superioris, the one that will help us to open our superior eyelid, this will be innervated by cranial nerve number 3, which is called oculomotor nerve. Now, in here then we have orbicularis oculi, which is the sphincter muscle that closes our eyelid. So if you want to blink, you will close this muscle, or sorry, if you want to close your eye. And then here we have is this muscle in here, corrugator supercilii, which is located just deep to this orbicularis oculi. This will draw the eyebrow immediately, like if you are suspicious of something. And then in here we have the nasalis muscle that, together with the levator labii superioris, which is this, they flare the nostrils, so allow us to kind of smell better. Now we have this frontalis, which connects with the occipitalis muscle by this fascia, which is called the gallia ponerotica, that helps to wrinkle our forehead. Now we have this muscle, which is called levator angulae oris, that help us to elevate the sides of our the area or angle of our mouth. Okay, so this will be the levator anguli superioris. Now this one, it's an antagonistic of the depressor anguli oris, which is this one in here. These depressor anguli oris, guys, make us look sad or do a pout. Okay, so they lower the bottom of the lip, the depressor anguli oris, together with the depressor labii inferioris, which is this one in here. And then zygomaticus muscles, major and minor, these two, it helps us to raise the corners of our mouth when we smile. So these ones are actually a couple of muscles that give us this nice, sincere smile. Whenever you are taking a picture and then you fake the smile, we have this muscle, risorius. So this will draw the corners of the lips just laterally. But this one, the zygomaticus major and minor, they raise the corners of your mouth when you're smiling. And then we have this muscle in here, the buccinator. The buccinator muscle compresses the cheek when whistling, blowing, or sucking. It holds food between the teeth during chewing. And we have this orbicularis ori in here, that it is a sphincter that closes our mouth. And this one will help us to also raise our lips, like when you are going to kiss. Now mentalis, together with the platysma, helps to tense the skin of our neck, and the platysma itself, it's located only within the neck area, the anterior neck area. It's not located posteriorly. Okay, masseter. Masseter is a muscle of mastication. This masseter is not part of the muscles for facial expression. This muscle is used for chewing, and this muscle is innervated by cranial nerve number 5, mandibular nerve, the mandibular branch B3 of the muscle, that trigeminal muscle, which is at some point the trigeminal nerve, the muscle that, the nerve that helps us to innervate the muscles of mastication. So here we have the temporalis, masseter, that are the muscles of mastication. So one of the functions of these temporalis is to elevate and retract the mandible, while the masseter only elevates the mandible. And these muscles, together with the lateral and the medial pterygoid, which are also muscles of mastication, are innervated by cranial nerve number 5, or trigeminal, by the mandibular branch, or B3. Now in here we have some of our muscles of the neck. We have here the omohyoid, sternohyoid, and sternothyroid, and the thyrohyoid. And then here we have some constrictors of the pharynx, pharyngeal constrictors. And then this is the lateral view of the muscles of facial expression, together with these frontalis and occipitalis. As I told you before, they are connected by the gallia aponeurotica. Muscles of the tongue and the pharynx. They have an important role not only in speaking and speech production, but also in bringing the food into the pharynx. So we have these muscles that are called the extrinsic muscles of the tongue. These muscles ends in the ending glossus. Whenever you hear the ending glossus, that means that they are connected to the tongue. So we have the henioglossus, hyoglossus, and styloglossus in here that are innervated by cranial nerve number 12, or the hypoglossal nerve. They depress and protrude the tongue, henioglossus. Hyoglossus depresses and retracts the tongue, and styloglossus retracts and elevates the tongue during swallowing. Now, whenever these muscles that are ending in the glossus nerve, in the glossus word, think about the hypoglossal nerve. And we have muscles in here of the palate. So palatoglossus. This one, this palatoglossus, it is a muscle that elevates the posterior tongue and brings the soft palate to the tongue. Now, palate word or rule, it implies that these muscles are innervated by cranial nerve number 10, or vagus nerve, with the exception of one muscle that is called the tensor belli palatini. This muscle is not innervated by cranial nerve number 10. Now these muscles of the palate are important also as well for the bringing of the food into the pharynx. And then here we have some of the muscles of the pharynx. So we have the middle pharyngeal constrictor in here, and then here we have the superior pharyngeal constrictor, and then in here we have the inferior pharyngeal constrictors. Now these muscles, the constrictors of the pharynx, helps to bring the food from the oral cavity into the esophagus, which is this tube in here. This is part of the digestive system. And then in here we can see the tongue, and the tongue has intrinsic muscles. So here is the view of the muscles of mastication, temporalis, masseter that has been cut, and then the lateral and the medial pterygoid. And then the buccinator, at some point it helps, but it's not for mastication. It's only bringing the food next to the teeth so we can chew. Now, in the case of the innervation of the intrinsic muscles of the tongue, so they have different innervations. So we have the lingual nerve, which provides general sensory information of the two anterior thirds of the tongue, and then this lingual nerve is part of the cranial nerve number 5, which is trigeminal. But we have this other muscle that is called the chorda tympani, which is part of cranial nerve number 7, which is the facial, that provides a special sensory innervation, taste, from the two anterior thirds of the tongue. And then we have the cranial nerve number 9, or glossopharyngeal, that provides a special sensory innervation or taste and general sensory innervation from the posterior third of the tongue. And then the hypoglossal nerve, again, cranial nerve number 12, provides somatic motor innervation to all the tongue muscles except for the palatoglossus, which is innervated by cranial nerve number 10, as I told you before. Now, when it comes to the muscles of the neck, so we have this suprahyoid group, which is the digastric muscle that has two heads, one that is called the anterior belly, and the other one is called the posterior belly. And then we have the stylohyoid that goes from the styloid process of the temporal bone into the hyoid bone. And then we have the mylohyoid that you can see it as well here in this this view. This is the mylohyoid that forms part of the floor of our mouth. And we have here the infrahyoid group, which is the thyrohyoid that goes from the thyroid cartilage, which is this, into the hyoid bone, and the sternothyroid that goes from the sternum into the hyoid bone. So if you think about of these muscles as a group, the suprahyoid group, these will elevate the hyoid bone when they contract. And these ones, the infrahyoid, they depress the hyoid bone. And we have here other members of the infrahyoid group, like the sternohyoid. And then we have the omohyoid, which is this muscle in here, its inferior belly and its superior belly. All of these will depress the hyoid bone. And as I told you before, the hyoid bone in general is this bone that it is not connected to other bones in our body. So it's the only unarticulated bone. It's only held by these muscles that we talk about, the suprahyoid and the infrahyoid. And the suprahyoid and the infrahyoid are extrinsic laryngeal muscles. The suprahyoid and the stylopharyngeus elevate the hyoid and the larynx, while the infrahyoid muscles depress the larynx and the hyoid bone. And they will help to modify a little bit the tone of our voice. So the laryngeal muscles are divided into extrinsic and intrinsic, and all of these are extrinsic muscles. This is the lateral view of the muscles of our neck. This will be the sternocleidomastoid. And then in here, we have some muscles that are called the scalenes. And then again, this is the view of the muscles of the tongue and the pharynx. And then for the muscles of respiration, so we have the actual diaphragm, which is a skeletal muscle. The diaphragm is innervated by the phrenic nerves. The phrenic nerves are nerves that derive from spinal nerves C3, C4, and C5. So cervical 3, cervical 4, and cervical 5. One mnemotechnic that I use for remembering the innervation of the diaphragm by the phrenic nerves is C3, C4, C5, keep the diaphragm alive. So if someone has paralysis of the phrenic nerve, the person won't be able to breathe. So this is part of the branches of the phrenic nerve that you can see here. And then we have the external intercostal muscles in here located in between the ribs. That's why they're called intercostals, and this will be the internal intercostals anteriorly. The external intercostals are inhalating muscles. So when we contract them, we elevate our ribs and we make our ribs to be horizontal so we can expand that thoracic cavity. And then we have the internal intercostals, which are exhalatory muscles. So when we contract these muscles, we depress the space between the ribs. So we decrease the space in our thoracic cavity so we can exhale the air. And then these external internal intercostals are innervated by the intercostal nerves that runs under the shaft of each rib. So we have 12 thoracic or 12 intercostal nerves. Now for the muscles of the anterior abdominal wall. So we have this rectus abdominis, which is the six-pack muscles. And then these are covered by this rectus sheath, and they are connected, the right and the left, by the linea alba, which is this lining here. And these muscles, they have these tendinous intersections that makes it to look like if they were segments. And then we have externally the external oblique or external abdominal oblique muscle, and then we have the internal abdominal oblique, and then we have these transversus. Why these are called obliques? Because their muscle fibers, they run in an angle. And then the transversus abdominis or transverse abdominal, the muscle fibers, they run horizontally. That's why they're called transversus abdominis. And then here we can see the better view of the internal intercostals and the external intercostals in here. And then here we have the pectoralis minor muscle and the serratus anterior in here. And this is the superficial view of the anterior abdominal wall muscle. So this is the pectoralis major. And then in here, the latissimus dorsi, the anterior view, serratus anterior. And then the rectus sheath was removed, and then you can see the tendinous intersections of the rectus abdominis. One of the functions of the rectus abdominis, since it connects between the pubic symphysis and the inferior edge of some of the the lower ribs, and also into the xiphoid process. When you contract this muscle, you increase intra-abdominal pressure together with all of these muscles in here, especially the transverse abdominal. But also when you contract this muscle, you can do kind of a sit-up, because you can flex the pelvic area over the abdominal area. And these obliques help us to do lateral rotation with our torso. These are the neck and the back muscles, so the superficial and deep view. So this is the trapezius. Trapezius, it's a muscle that it has this trapezoid shape. It connects to the spinous process of several vertebrae from cervical up to mid-thoracic, and then it connects as well in here to the spine of this scapula. So one of the actions of the trapezius is to elevate our shoulders and also to bring our shoulders posteriorly, so you can shrug your shoulders. Trapezius is innervated by spinal nerve, which is cranial nerve number 11. So one of the ways to test for the functionality of this nerve is to ask the person to shrug his shoulders against resistance. So when you do that, and if the person won't be able to do it, the person's spinal nerves, the accessory spinal nerve might be damaged. So as well, this nerve is innervated by C3 and C4. So one of the proximal attachments will be the occipital bone, as you can see here, and then the nuchal ligament, and then it goes from C7 to T12 vertebrae in its proximal attachment, and then the distal attachment will be the spine, the acromion, and the lateral clavicle. Now in here we have the levator scapulae. As its name implies, elevates the scapula, and it does the rotation of the scapula as well. This one is innervated, for instance, for the levator scapulae by dorsal scapular nerve, or that it's coming from the fifth cervical nerve. Then we have rhomboid minor and major in here, and then both of them, they help to retract the scapula. And in the case of the serratus anterior, which is this one helps to protract upward in the scapula and move it into an upward rotation. And then here we have the erector spinae muscle, and then in here we have the serratus posterior inferior covered by the latissimus dorsi. Latissimus dorsi helps to adduct, extend, and perform medial rotation of the humerus. So this is one of the muscles, together with the trapezius, that is used to help do this medial rotation of the humerus, and it is very useful by swimmers. Now here we have teres minor, teres major, and these muscles are part of the rotator cuff muscles. So supraspinatus, infraspinatus, teres minor, and subscapularis, all of these in here are part of the rotator cuff muscles. So they help as a group, these rotator cuff muscles, to stabilize the humeral head in the glenohumeral joint while the shoulder will move. Now in here, in the gluteal area, we have the gluteus medius and the gluteus maximus, and if you remove them, you will be able to see this erector spinae, which help us to maintain this erect position, so when we're standing. And then in here we have the internal abdominal oblique, the posterior view, and then if you remove the gluteus maximus and the medius, you will be able to see the gluteus minimus and the lateral rotators, which help us to maintain this position of our leg with the toes pointing anteriorly. So muscles that act on the vertebral column. So we have these longissimus capitis and splenius capitis that help us to maintain our head up. We have the semispinalis capitis and semispinalis cervicis in here with the semispinalis thoracis, which basically it's a single group of muscles, these semispinalis. Why they're called semispinalis? Because they attach into the spinous process. And then here we have the serratus posterior superior. And then we have here the erector spinae, which consists of two muscles, iliocostalis, which is this, then the longissimus, and then the spinalis, which is this. And then here we have the serratus posterior inferior that help us to retract our inferior ribs. And then in here we have the internal oblique and the external oblique, the posterior insertion of these muscles. And then we have this muscle that's called multifidus, and then the quadratus lumborum, that not only helps to depress these floating ribs, but also protects our kidneys because our kidneys are located anteriorly to this. And then we have the muscles of the pelvic floor in the males that consist of this superficial transverse perineal that goes from the ischial spine to this perineal body. And then here we have the bulboespongiosum and the ischiocavernosum. And then here we have the levator ani and the gluteus maximus in here. In females, it's the same muscles, the muscles of the pelvic floor. So here we have this muscle that we saw before, the transverse, deep transverse perineal muscle. And then in here we have the bulboespongiosum and the bulbocavernosum in here. And then they form this triangle, the urogenital triangle. And then we have here the anal triangle. So this is the levator of the anis, just similar to this. Now we have some deep muscles of the pelvic floor, like the iliococcygeus in here. It goes between the ilium and the coccyx. And then ischio-coccygeus, because it goes from the ischium, the ischial spine, into the coccyx. And then we have this piriformis muscle. And then here, this is the superior view that you can see. Here are some nerve roots of the anterior sacral foramina, emerging from the anterior sacral foramina. And then this is the pubococcygeus, because it goes between the pubic bone, which you have in here, and the coccyx, which is here. Now the muscles that act on the scapula. So we have muscles that produces lateral rotation, like the trapezius and the serratus anterior. The muscles that produces medial rotation, which is levator scapulae, rhomboid major, rhomboid minor. The ones that elevate the scapula, like the levator scapulae, the trapezius, rhomboid major, minor. And then the ones that depress the scapula, like the trapezius, the inferior part, and the serratus anterior. And then we have the retractors, which are the rhomboid major, minor, and the trapezius. And then we have the protractors, which are the pectoralis minor and the serratus anterior. For the muscles acting on the shoulder, we have the pectoralis minor and serratus anterior. And the shoulder muscle precisely itself, which will be the deltoid, was removed, but it's supposed to be here. So here will be the deltoid, and then we have all these muscles in here as well that we already mentioned. Muscles acting on the arm. So we have this biceps brachii that flexes and supinates the forearm. So it helps us to bring the palm a little bit inward. Brachialis, which is this one in here, that helps to flex the forearm. So it's a synergistic of the biceps. We have the coracobrachialis, that it is this muscle in here that flexes and adducts the arm. And then we have the posterior compartment of the arm, which is this area. So here you have the triceps brachii with its lateral head and the long head. If you see here in this view, in the anterior view of the arm muscles, here you have the medial head of the triceps. So why it's called triceps? Because it has three heads. It has the lateral head, the long head, and the middle head. And in here you can see the lateral and the long head. The biceps has two heads, the long and the short. So this is the long head of the biceps that inserts into the radial tuberosity, just underneath the head of the radius. And then this is the rotator cuff muscles in relationship to the scapula. So remember, here we have the spine of the scapula. So this is the supraspinatus because it's above the spine. This will be the infraspinatus because it's below the spine. And then here we have the teres minor. And then this is the subscapularis because this is the subscapular fossa. So actions of the rotator muscles of the forearm. So we have here pronator teres and pronator quadratus, which help us to pronate the forearm. And then here we have the supinators. So supinator is only one. Sorry, I said two. It's a supinator, but it's only one. So this is the supinator. This one, it helps us to supinate. So supinator is an antagonistic of the biceps brachii and also of the pronators. So we have pronator teres, which means round, and pronator quadratus, which is square. Now the flexors of the wrist and the hand, they are located anteriorly. So this is the anterior view. So we have superficial flexors, intermediate flexors, and deep flexors. So here we have flexor digitorum superficialis, covered by this muscle, which is the brachioradialis. Why it's called brachioradialis? Because it goes between the brachium and the radius. This is the radial side. And then in here we have the flexor carpi radialis. One of the actions is to flex the carpi. So you flex your wrist and towards the radial side. So it's basically, you can flex it in your carpi, your wrist, and it goes to the lateral side. And then here we have the palmaris longus, which help us to tense this palmar aponeurosis. So when you're tensing your palm as you are overextending your palm. And then this is the flexor carpi ulnaris, which flexes the carpi as well, just like the flexor carpi radialis, but it's in the area of the ulna. So this one flexes the carpi and also bring it a little bit medially. And these muscles are part of the posterior compartment of the forearm. Sorry, anterior compartment of the forearm. And then the anterior compartment of the forearm contains the pronators, the flexors, and all are innervated by the median nerve except for the flexor carpi ulnaris and the middle part of the flexor digitorum profundus, which are innervated by the ulnar nerve. So this one is innervated by the ulnar nerve together with this one, the flexor digitorum profundus. The rest are innervated by the median nerve, and this is the flexor pollicis longus. So this one help us to text together with the flexor pollicis brevis, which is underneath this one. So if you make a cross section of the upper limb, you will be seeing the compartments. So this will be the posterior compartment with the triceps, and this will be the anterior compartment with the biceps brachii, the long head and the short head. And then you can see it here as well. And here in the forearm, you have these compartments created by the interosseous membrane between the radius and the ulna. So always, guys, in the forearm, the anterior compartment, the one in green in the forearm, this one flexes while the posterior compartment extends. So this is the posterior compartment. So what do? This will extend. So we have the extensors of the wrist and the hand. So in this posterior compartment of the forearm, we have the extensors and supinators, with the exception of the brachioradialis, which flexes the forearm, and all are innervated by the radial nerve. So here we have extensor carpi radialis longus, so this is the superficial extensors. This is the extensor carpi radialis brevis. So they extend the carpi, so they are antagonistic of the flexors of the carpi, and they also bring the carpi laterally. So they extend the wrist, and then they move it a little bit laterally. And then here we have the extensor digitorum that extends our fingers, and then this is the extensor digitorum minimi. So this one extends the pinky. And then we have the extensor carpi ulnaris. And then they all end in these tendons that inserts into our phalanges. And then here we have the tendon of the extensor indicis that extends specifically our index finger. And then here we have the extensor pollicis brevis, which helps to extend our pollex. And then here we have the extensor pollicis longus. And then here we have the deep extensors, so the anconeus, which is actually one extensor as well, together with the triceps brachii. So they are the anconeus is synergist of the triceps. Here we have the supinator, and then abductor pollicis longus, which abducts or bring out our pollex. This will be the extensor pollicis brevis. This will be the extensor pollicis longus and extensor indicis. So we can extend our index. Now, some of these muscles are embraced by the flexor retinaculum. So it looks like a bracelet because the fibers runs horizontally. They are located within the wrist. And then this will help for the flexor tendons to go crossing the wrist without having any damage as we flex and extend our wrist. And then sometimes our wrist will have an inflammatory process that is called the carpal tunnel syndrome. So what is the carpal tunnel? It's a tight space between the flexor retinaculum and the carpal bones. So the flexor tendons passes through this tunnel and are enclosed in these tendon sheets. So this will enable, as I said before, the extension and the flexion of the carpi without damaging these flexors. And then carpal tunnel syndrome is a prolonged repetitive problem because you will have the swelling of these flexor retinaculum that is going to entrap your tendons, and then you will have prolonged repetitive motions of wrist and fingers caused by the inflamed flexor retinaculum, and that will put pressure on the median nerve. And if you remember the median nerve, it is the nerve that innervates most of the muscles of the anterior compartment, so the pronator and the flexors, but except the flexor carpi ulnaris. So you will put this pressure then on the median nerve, and that will cause tingling muscular weakness in the palm and the middle side of the hand. And the pain will sometimes be so intense and may radiate into the arm and the shoulder. So the treatment usually is surgery, because this is a refractory problem, but sometimes the doctors before surgery, of course, give anti-inflammatory drugs and then immobilize the wrist. So this is the flexor digitorum superficialis tendon, and this will be the flexor profundus. And this will be the flexor retinaculum, this will be the carpal muscles, this is the anterior view of the flexor retinaculum, and this is the median nerve. So when you have inflammation of this compartment, you will have compression of the median nerve, and then you have problems when you're flexing your wrist. Now our muscles in our hand will be the intrinsic muscles. We have lumbricals that are located in between the metacarpals, and then we have muscles of the tenor area, which will be located next to the pollex, and the hypotenor area. So what are the muscles of the tenor area? Will be the first dorsal interosseous muscle, the adductor pollicis, flexor pollicis brevis, adductor pollicis brevis, and the opponents of the pollicis. Remember what I said before, that one characteristic of humans is the ability of opposing the fingers with their thumb. And then this will be the hypotenor muscle, so these will be the opponents digiti minimi, so we can oppose also the rest of the fingers with the pinky. And then this will be the adductor digiti minimi and the flexor digiti minimi brevis. Now let's talk about the muscles that act on the hip and the femur. So we have iliopsoas, which is made by two muscles, the iliacus that is inserted into the iliac fossa, and the psoas major that runs from the lower vertebrae into the femur. So this will help to flex the vertebrae of the lumbar area, so when you are flexing your torso. And then we have the piriformis muscles in here, and the obturator externus, which is inserted here into the obturator foramen. So this will help to adduct the femur. And then here we have the adductors. So we have one muscle is called pectineus that runs here between the pubic bone and the upper part of the shaft of the femur. And then we have here the adductor magnus, adductor brevis, and adductor longus. So all of these, they adduct or bring medially our femur together with this long muscle that is called the gracilis. And then the gracilis inserts here into the medial condyle of the tibia. This is a posterior view of the muscles acting on the hip and the femur. So we have the gluteus medius, gluteus maximus, and then the gluteus minimus, together with these piriformis, and then these gemellus muscles, obturators, internus, externus, and then the quadratus femoris. All of these help us to maintain an erect position and to walk. And then this is the superficial view of these muscles on the posterior part of our thigh. So we have here the gracilis. Here we have this muscle that is called the semimembranosus. This will be the semitendinosus, and this will be the biceps femoris, the long head and the short head. So all of these are part of the posterior compartment. So this posterior compartment help to flex our our knee. And we have in the anterior view one muscle that is called the sartorius that flexes the buttocks and laterally rotates the thigh and flexes the knee as when we are crossing our leg. Now, the muscles in here in this area are called the hamstring group. The biceps femoris with its long head and the short head, semitendinosus and semitendinosus. So these hamstrings are extensors of the thigh and flexors of the leg from medial to lateral. The nerve that supplies these muscles of the posterior compartment will be the sciatic nerve and the common peroneal and fibular muscles for the short head of the biceps. Now, for this will be the vastus lateralis, the posterior view, and then here we have the adductor magnus again and the gracilis. The anterior thigh muscles are muscles that extend the knee. So we have here the quadriceps that is made out of 4 heads. This will be the rectus femoris, the vastus lateralis and vastus medialis, and if you remove this, you will be able to see the vastus intermedius. So if you want to work out your quadriceps, one of the exercises that you have to do is extend your knee. Now for the muscles that act on the foot, they are subdivided into compartments as well. So if you see this section, cross section of the leg, you will be able to see this posterior compartment, which is flexor, and then you have this anterior compartment, which will be the extensor. So the extensors or muscles of the anterior compartment. So we have the tibialis anterior. So when you contract your tibialis anterior, if you want to feel it as you have your knee flexed, and when you are sitting, you can feel the contraction of your muscle as you are performing this dorsiflexion. So tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius, all of them are part of the dorsiflexors of the ankle and extensors of the toe. They are innervated by the deep peroneal nerve or fibular nerve. So here we have the extensor digitorum longus, so this extends our toes. This is the tibialis anterior, extensor hallucis longus, that extends our big toe, and then this is the extensor digitorum longus. And then this is the fibularis tertius. Now in the posterior compartment of the leg, we have the plantar flexors of the ankle, flexors of the toe. So these ones will help us basically to walk on our toes. So we have the gastrocnemius, soleus, and plantaris. So gastrocnemius has 2 heads, the medial head and the lateral head. If you remove it, you will be able to see the soleus. And all of them, they end up in this tendon that is called the calcaneal tendon that is inserted into the heel. And all of these muscles, they have this antagonistic function, so they create plantar flexion of the muscles of the anterior compartment. And then in the deep posterior, we have the flexor hallucis longus, we have the flexor digitorum longus, tibialis posterior, and the popliteus. And all of them are innervated by the tibial nerve. So this is the deep view of the muscles of the posterior and lateral compartment. Now in the lateral compartment of the leg, we have the ankle evertors. So we have the peroneus longus and the peroneus brevis, which are fibularis longus and fibularis brevis. That's the other name. And they are innervated by the superficial perineal or fibular nerve. So I already talked about these two. And then as well, similarly as to the hand, we have intrinsic muscles of the foot, which will be the lumbricals as well, that are located in between the metatarsals. And then we have this adductor digiti minimi, so you can abductor, so you can at some point, if you work it a lot, you can just move laterally your small toe. And then you have the adductor hallucis. That one is pretty easy to move out the great toe. And then we have the flexor digitorum brevis inserted into here. We have the quadratus plantae in here. And many of these muscles that you have here, like the quadratus plantae, the flexor digitorum, and then the flexor digiti brevis, and all of these that you can see, including the plantar interosseous and the dorsal interosseous, what they do is they provide a structural support to our foot, and then it helps us to walk better. So this is all for this chapter, the muscle chapters. And if you have any questions, feel free to email me. And for some of you, have a good day or have a good night. Bye-bye.